Genes we cannot change, definitely. But yes, what we can change is our lifestyle and diet. So everything again relies upon the lifestyle, diet, yoga, we are all talking about exercise. This is one thing which we can change and we can bring down the incidence of other gynecological cancers in this.
Thanks a lot, ma'am. I think Dr. Kaur is suggesting the yoga of various medical specialties, perhaps. That's the order. We welcome Madam Dr.
Dr. Ramesh Davar, Madam. She's a leading pathologist and founder of, co-founder and vice president at Dharamshila Cancer Research Hospital. And we welcome you to the forum, ma'am. And while we're talking about prevention in oncology, I think your views, and she's an Amazonian, and we would like to hear Madam's views as well. So just giving 2 minutes, I think.
Yeah. So before Madam comes in, ma'am settles down. हमारे आयुर्वेद में I think from Subhati Yoga and Naturopathy कहते हैं कि स्वास्थ्य की जो पहचान है वो त्वचा की कांति से बहुत अच्छी होती है. And we have a very leading cosmetic surgeon with us, and maybe his views, Dr. Vipul Nanda, कि स्वास्थ्य की जो external पहचान है वो कैसे हो, sir?
I think beauty lies within, so I can pass it on.
So, a bit about prevention in skin and how you would say how plastic surgery,
So mostly we are dealing with the end results of aging or things like that. So I think for prevention, I think a lot has been said already. We are dealing with the reconstructive parts in cancer and the tertiary care and all that. So far away from prevention. Maybe somebody else can talk about prevention.
So we request Professor Davar Madam to speak about. Ma'am has such a passion for oncology, onco-prevention, and how caringly she thinks about the women patients with breast cancer, designing gowns, and not just clinically tending to them, but to the last mile. We would like to hear Ma'am's journey and thoughts on this.
And more from the medical agenda, the subject matter of the first session was the enterprise of healthcare. We have listened a lot about the Infosys story, 7 founders coming in, and Madam is one of the 9 founders at Dharamshila Cancer Hospital. So that's another management experience as to how such a fabulous healthcare facility was created out of private enterprise. So that's also somewhere Ma'am can really remind you for him. Thank you.
Listen to press.
Good afternoon, everybody. I'm sorry I'm a little late. I first would like to thank everybody, and especially the organizers, for letting me come here. I'm sorry I'm a little late. Basically, what it was, you have to want to do something is what I'll say. I was doing fine working at AIIMS, but I didn't like how we were treating cancers at that time. And luckily, a friend of mine lost her father, unfortunately, to cancer. And at that time, we were not very happy, despite our both being doctors and I was at AIIMS, we could get to practically anywhere. At that time, this idea of having a private cancer hospital, which would actually look after the middle class. Little strange thing to do, academician and a pediatrician in practice, to think of making a cancer hospital. I look back and I think we were pretty silly about it. But anyway, it happened. It didn't happen because of me or her. It happened because, I don't know, 10,000 people maybe helped us make it. And I must say, very grateful to the faculty of AIIMS itself, who very generously helped us plan the setup, etc. Now, when I used to talk about cancer at that time, unfortunately at that time when we looked around, believe it or not, Delhi had 75 cancer beds. Not a very good thing to say, but that's all we had. We counted everyone that we could think of. And for a city of this size, with all the migration occurring, that was honestly not even feasible to look at. So that's how the two of us thought, something has to be done. And then luckily, some other friends who had cancer in the family, some of them we had helped with getting things done, so they joined us and we decided it's going to be done. And God has been kind, a lot of people have been kind, as I said, at least 10,000 people, I'd say, have helped us out. And we were able to do it. Now at that time, you see, well, even today, among the general public, I'd say, cancer, you know, going to die. Well, I feel very proud that today, so many years later, I can talk of cancer prevention. And I can talk about diagnosing cancer earlier and curing it. And I'm sure, you know, great speakers around, and it's something I always say, it has come to where we've started thinking of cancer as a chronic disease, honestly. I mean, at our hospital we have lung cancer patients who we've carried through 8 years, 9 years. And lung cancer was supposed to be totally fatal at that time. Right from the beginning, somehow, I've been very keen on cancer screening because treating cancer is expensive. I know it. I'm sure everybody here knows it. But we had to do it if we can prevent it somehow or pick it up early. It's the right thing to be doing. As like a mission working at AIIMS, we don't have much time to think about these things, but we did think about them. And actually we've been involved in as little screening as we can carry out all the time since then. Not too much, but a little. Now that I'm older and some of my responsibilities have become a little less, I've gotten into it in a big way. And we've gotten into cancer screening in the general public like it should be done. Well, what should I say about it? Right now we have a mobile unit in which we've got a mammogram machine, we've got an X-ray machine, we've got an area for pap smears to be done, we've got an area where we can examine the men for their oral cancers, etc. And with that mobile van, we are organizing camps around the city. We don't go too far, just around the city, NCR region, kind of, a little bit occasionally into Gurgaon. And right from the start, even when we didn't have the money, very honestly, this was one area that I said, we're not charging for. If we're going to do it, we're not going to charge for cancer screening. It's not something that I would feel right doing. So since then, we have been finding the funds for this cancer screening program. And I'm really feeling good these days because we're organizing about anywhere from 8 to 10 camps a month around the city area. I have a team of 4 or 5 people who go around doing this also. And within the hospital itself, because of my experience while working at AIIMS and even here, and knowing all this, that money becomes a very big thing in cancer screening, we will put a program we call the DISHA program. It's the journey forward once the cancer has been diagnosed and we're going to start treating. And I've got 2 MBBS doctors on my team. I've got a psychologist, I've got a social worker, and I've got a couple of nurses on it. And they work as a team. In fact, I had asked one of my doctors who's been with me for about 5 years to come here and do it. But they're the ones who run the DISHA program in the hospital and the screening programs around the city and in the hospital. Now, I learned a lot. To me, it was obvious cancer screening must be done. But you'd be surprised how few women want to get it done. And then, of course, you look around, and I can remember one of the first ones we organized at our own hospital. I said, somebody was willing to fund it because I was not going to, if I was going to get it done free, the pap smears, that everything had to be done, it had to be in the hospital. Otherwise, we'd have to shut down the hospital, unfortunately. We didn't want to do that. So we used to find funds, and I can remember I was given permission for the first camp I organized within the hospital itself for 100 ladies. Cancer screening. I said, fine, we'll do 100. Well, when we finished the 100, there were about 10 or 15 left over. So I had kind people who had given us the funding for it. I asked them, I said, look, I got 10 or 12 people left over, ladies like to be screened. And they were said, oh, okay, 25 more you can do. So I figured, okay, I'll do these 10 or 12. And the 20 remaining, I'll pick up my own staff. The ladies over 40. So I had the HR people pull out the thing, finish those 10 or 12. And then I got to my staff. Well, you're not going to believe it. I literally had to force some of the ladies in the PATH department, where I was part of my work was there naturally. I had to force them to go for that screening program. And then a few more came. So that's how we started the screening program over there. Since then, of course, things have been much better. And right now, as I said, we do about 8 to 10 camps every month around the country, in the NCR region, I shouldn't say country. We have been in the hospital where somebody can call up, we give them an appointment, and even there we do it free for them. I think the big thing we have in this is because I have this team which is totally involved in it. We get the phone numbers, everybody's got a mobile phone, and we follow up every patient, every lady, I should say, who comes for screening, or every gent actually, because some of the corporates we go to, they have mostly men, so we do the oral and x-rays, high risk for lung cancer, we do the x-rays for them. But I still think a lot has to be done in this area of prevention. And the other thing, of course, prevention with lifestyle changes. I think everybody sitting here has a very good idea about it. And I remember I used to talk about it as a professor at Ames to the undergraduate students, and that somehow every year used to be my teaching for neoplasia. So with that, we talk about in the seminars, etc., about what to do about cancer and what lifestyle changes help. And obviously, the first thing everybody wanted to know was what do we eat? A very important thing to do. So I used to say, well, the easiest way to figure out what you should eat is to eat everything your grandmother and your mother wants you to eat. And forget about all the other things that you would like to eat. I said, do that once in a while. But everything else, what your grandmother wanted you to eat and what your mother wants you to eat, that's the best diet you can have in your lifestyle. And then, of course, for them, I explained it a little bit and tell them a little more about it. And I think if we still follow that, and of course the other things, it's the best thing one can do in this situation. And somehow it comes across well with some of the women especially, that I am recommending that you eat what they tell them to eat. Now, how far we all do it, I know we all goof off on sometimes, but that's allowed. I always allow that. So basically, what I'm happy about now is at least we're doing this screening. And the main thing, well, as you know, screening, you don't pick up too many cancers, but we do pick up leukoplasias, we do pick up occasional atypias, etc. But the other big thing I learned, especially when we started doing a lot of these cancers, is that you pick up a fair amount of infections, prolapses, etc. Now these, especially in women, who anyway, even the educated and those who can afford, don't go to the doctor very often, even when they're sick. This is very important because it's just one little prescription and it takes care of the problem. So the majority of what I'm picking up on these camps that I'm doing are these benign lesions. Kisi ki polypathy, somebody's got a prolapse, then my people can direct them where to go. And with the Disha program that I have going there, what I've also learned while making the hospital is that there are a lot of generous people. And my attitude now has become that we have plenty of money in this country. You just have to find it, and you don't have to look very hard. I mean, as an academician and a practicing pediatrician, we really didn't have the money to start building a cancer hospital. We were stupid enough to think we could do it. Well, that's where I learned how generous people can be. I'll be honestly, the 9 people that we promoted the hospital, we just collected money among ourselves to buy the initial plot of land, that's all. Everything else, generous people here. Luckily, I have good friends in the US where I did fair half of my education. They were generous. Everything else, people have helped us. So I always tell all my friends and all my, never worry about money. You can always find the money, you just have to look for it. And honestly, for patient treatment of cancer in the Disha program that I'm running in the hospital, when they say, we'll go home and collect the money, I said, okay, I'll help you find some money, you find the rest, but start your treatment now. And believe me, I do find that money for them, and very proud.
Such an overwhelming exhortation, and I think it's more than much more than an exhortation. It's a life sadhana and tapas. We would like now to invite all our distinguished healers and doctors and healthcare regulators and guests for today to join us for a tea break. So we'll just, in the foyer, some tea is arranged. We request all our distinguished guests. We're also joined by Dr. Rashmi Ranjan Das and Dr. Ketan from the pediatric pulmonology team at AIIMS Bhubaneswar. So we'll join for tea, and then post tea, I think tea break, we'll have some the award ceremony and interactions. Thank you so much. And just break for tea.